is the learner education series. I had this series since long. Series 1, Series 2, Series 3. The Series 3 was about the detailed understanding of miasm as explained by Dr. Praful Vijayakar sir. Right? तो साऊंड इथे येत आहे त्या रूम मध्ये कॅबिन मध्येच. Right? So it was wonderful online session. You can assess or you can listen, learn the miasm from that recording. The recording was uploaded in the YouTube. See, now this is the special session series I have started. That is the diagnostic and homeopathic approach in psychiatric disorder. Myself, Dr. Pankaj Nimje, MD, SCPH, SCPH plus, and MD in psychiatry subject. So I have the experience when I was doing MD in ML Dhole Homeopathic PG Institute, Mumbai, Palghar. Right? So in that hospital, there was a lot of clinical IPD and OPD experience we have got through the direct patient management. It is not just a theoretical understanding, it was a direct practical application of homeopathy on the patient, especially the psychiatric cases. Right? So that knowledge and the practice since 2010, there was a lot of psychiatric cases I have treated. Some cases I have recorded and some not. So according to the availability, I will show you as much as possible the cases where what is the motive of showing the psychiatric cases or taking these special sessions are the as a homeopath, there are the lot of cases comes to us with having the psychiatric ailments, right? Definitely, most of the cases have psychiatric illness, and after COVID, the mental illnesses got rise to amplified to the extent that most of the people who get suffer in the COVID crisis maybe goes into the anxiety disorder, depression, and yeah, maybe goes into the OCD, some goes into some other disease like maybe schizophrenia, but anxiety and depression patients are most after COVID because of the crisis in the business, crisis because of the separation from loved one, loss of loved one. That needs to take the attention, and if we are able, or as a homeopath, though it is not necessary that everyone must be a MD psychiatrist to treat the psychiatric illness, if we are aware about the psychiatric illness and if we are in a position to diagnose the psychiatric condition, because why this so, in order to understand the common and uncommon, the most important thing that we should know is the diagnosis of the clinical condition. Right? If we don't understand the diagnosis, and if we just take the plain symptoms that the patient is anxious talk is there, they are more concerned about the health, more concerned about the disease, and if we are not understanding the proper diagnosis, and if we are finding the remedy by collecting the rubrics, anxiety, health, about fear of disease, fear of heart disease, like that, if we prescribe the remedy on that basis, then the remedy we prescribe is only on the basis of the common symptom. And what is the hallmark principles of the homeopathy is prescribe the remedy on the peculiar characteristic uncommon symptoms. Whatever the common symptoms patient narrated is for the diagnosis, right? Is for the diagnosis. If we using the diagnostic symptoms for the prescription, then the remedy might be partial. The patient may get the partial relief or there is a no relief at all. So in order to understand it properly, we should understand the diagnosis, psychiatric diagnosis or mental illnesses. Different, at least the most common mental illnesses, so that when we deal with it, when the patient comes to us, we can understand this is the generalized anxiety disorder, this is the OCD, this is the major depressive disorder or depression. So that the common symptoms, the sadness, suicidal thought, or whatever that symptom that patients telling to us, will not consider in a totality of symptom, right? So the most of the time, this is the mistake that we homeopath do, and then the treatment or the relief will not be according to what we expected, right? So my plan was to start the today's first session with the mental status examination, because what is applicable to derive the physical diagnosis like pneumonia, like bronchial asthma, allergy, there are the certain parameter, right? Certain symptomatology we have take the history properly, then we do the investigations, blood investigation, x-ray, MRI, CT scan, and then we come to the conclusion that this patient is having the having rheumatoid arthritis, having the allergic rhinitis, bronchial asthma, like this, or pneumonia. Barabar. So there are the certain criteria to come up with the physical diagnosis like this. The in order to derive the mental diagnosis, we have the mental status. We need to understand the mental status examination. If we understand it properly, then we can apply it each and every mental illnesses, so that we can come to the proper diagnosis ki this case fit into this disease and this disorder, right? But before the understanding the mental state, or the way we have to take the case as far as the psychiatric disease is concerned, we have to first understand the homeopathic case taking, right? Before a psychiatric case taking, we have to understand the homeopathic case taking, so that we can apply it powerfully into the psychiatric illnesses. Because most of the time, what Hanuman in his aphorism, what Dr. Praful Vijayakar sir explain in their books, the most important part in our case taking is the observation. The observation part, as a homeopath, we should be keen about the observation, right? So when we do the case taking, the most of the point we cover, as in the when we do the MSc or mental status examination, already in the case taking, most of the time we have to do the psychoanalysis. What is the psychoanalysis? It is nothing but the understanding the conflict. It is like a we have to understand the evolution of disease as far as even the evolution of person. So when we do this, when we do the longitudinal study in the case, when we do the cross-sectional study in the case, then we can able to understand that person properly, right? So the sessions, the 12 to 15 session, whatever we come up with, have a group of 12 to 15 sessions. It has the first case taking, homeopathic case taking, then psychiatric point of case taking, to this session, you get the psychodynamic and psychosomatic study of each psychiatric illnesses that we presented through the case, because just a theoretical application of GAD or panic attack or OCD will not sufficient to tackle the such cases, because in the aphorism already the Hahnemann has mentioned that the psychiatric cases or mental illnesses are the one-sided disease. One-sided disease means that is already it is the diseases which are difficult to treat, and we have to learn the skill. We have to learn the skill to solve or to crack or to manage such a one-sided illnesses, right? With this, we have to understand in each and every cases psychodynamic and psychosomatic study the conflict behind each and every cases. With this, there is a rubrics, how we derive the rubrics, miasmatic analysis of the rubric, because just deriving rubric and put it into the repertorization and emerge just a remedy is not sufficient, because each and every case need a different approach, right? If you see the every case, if you solve every case with the same approach, maybe it is a psoric रहेगा या psychotic या syphilitic, and your approach will be the same, then you can't able to solve the gross pathological or the higher miasmatic cases. The approach in psoric diseases, like that means the functional diseases, is differ from if you are treating the psychotic diseases, and it is much differ if you are treating the syphilitic conditions, yeah, syphilitic disease condition. So the approach will be different, right? So how the approach will change, that will we will see, right, according to the miasmatic understanding. And there are the cases which is very common in our practice, so that you can aware about it, so that you can tackle it confidently, right? What to see and what not to see, what to pick up, what not to pick up, which rubric is important, which rubric is not important, all the things we are going to discuss. Barabar? All the things we are going to discuss one by one, right? So we directly come to the jump to the homeopathic case taking instead of the mental status examination condition, right? There is still one participant. Who is this? Ananthi, Dr. Ananthi.
Yeah.
You are not muted. You are unmute yourself. Please mute yourself. All background sound is hearing. Please mute yourself. Yeah. So homeopathic case taking. See, we have seen this title lot of times. Even we have read it from different book, from different authors, maybe from the pioneers. But still, if you see every times someone discuss this, explain this, you get the new things. Barabar? This is as guided by Dr. Praful Vijaykar sir. This is the case taking guided by Dr. Praful Vijaykar sir, or the indications for the each and every cases how to tackle or manage. The way they approach, the way they solve the cases through understanding of the embryology, through understanding of the conflict, and through understanding of miasm is miraculous. Because they have the power, that approach has the power to treat the each and every cases, whether it is a psychosyphilitic or whether it is a syphilitic cases. Because it is very easy to solve the functional cases like a soric cases, but it is difficult to solve the psychosis, psychosyphilitic and the syphilitic cases. Barabar, how it differs, the approach, how it differs, and what care we have to take in order to understand the totality, that we will see in the consequent sessions. Now, most of the time, I have heard that, we always heard that the genetic constitutional similitude. There is a word already in the aphorism in the Organon of Medicine, explained by Dr. Hahnemann sir, that there is a constitutional remedy. There is a additions of the word the genetic constitutional similitude. Sometimes it is the Dr. Praful Vijayakar sir called it as a genetic constitutional stimulus, that the one dose or the minimum dose, if I prescribe, it stimulate the energy, vital energy, and itself even the gross pathological condition get cure. So in this, the additional revolution, additional understanding in the homeopathy, the Dr. Praful Vijayakar has do the lot of efforts and put forward the genetic theory. They put forward the understanding of embryology. In our case, understanding of embryology in proving the herring slop cure, in understanding the herring slop cure. So when we called it as a genetic constitutional simillimum, that before that we have to understand what is the gene. Gene is the fundamental unit of the inheritance. Gene is the fundamental unit of the inheritance. It is the structure in the DNA. One DNA molecules contain the 1 lakh genes. And all this DNA structure or gene is made up of different proteins, amino acids. Now these proteins, amino acid, gene, genetic material, DNA structure define or decide the human nature and human structure, our physical body, our nose, our color of hair, our structure, build up, physical makeup, all, including the sensitivity of the person, the nature, how he must behave, how he must react in particular situation. That means it is a blueprint of the person, right? So when we dealing with the cases which having the genetic origin, which having the origin long back, which is deep rooted, we have to understand this genetic prescription. In order to make the genetic based prescription, it is very important to understand the presentation of gene in the human body, how the genes present himself, right? How we understand whether the genetic expression of the person by the skillful history taking, where a specific pattern and system of questions are followed in each and every case. But it is not a fixed pattern, but specific pattern, so that we can understand the expressions of gene, or we can get the symptoms where the genes gets expressed, right? Everything from the thinking process to the emotions to the expression to the look, physical body, and even the disease presentation, all are the representation of the genes, right? How you look, how we look, What is the stature, build up, short, long, the way of talking, the way of sitting, the posture, all are represented by the genes, right? Also, it will be depends upon the underlying fundamental defense process. The disease presentation, as it is, depends on the genes. It also depends on the fundamental dominant mechanism, fundamental defense process, that is called as the mechanism, right? So this, if I understand the genetic expression, you can able to concrete it properly and make it the proper totality. So which symptoms are important, which symptoms are not important, because when we take the case, right, there are the lot of symptoms and most of the time we become confused कि which symptoms are important, which symptoms are not important, right? I have taken a lot of cases, including the the migraine cases and all other cases, that shows that how we classify the symptoms on the basis of miasm. So, if we miasmatically classify the symptoms, we will get the importance of symptom. If we classify the symptom according to the will, according to the conscience, according to the intellect, according to the emotional reaction, then we will understand the importance of each symptom. How these symptoms are the important in this case. For example, most of time we take the craving as an important parameter to select the remedy. Most of time we take the fears, fear of height, fear of dark, in the psychotic or or syphilitic cases, to enter into the remedy or to select the remedy. But what is the fear, what is anxiety? This is the emotional reaction. So how we compare the, if there is a will symptoms or the symptoms related to will and symptoms related to emotional reaction, then if you have these both symptoms, group of symptoms, so which symptom is more important, that we will see in the next slide. Take proper attention so that, and note down the things whichever you understand or whichever it is the important in your practice. All these are the practical hints that we are going to explain and share, so that you can directly apply into your practice, right? So एक case taking, if you see, केस टेकिंग तो है, जो प्रोफार्मा है उस, like in that way we are taking the case, no matter, right? But the most important in the case taking is the observation part, because the observation is the not involuntary but unconscious in the observation. For example, if the patient are with sitting with the on the edge of the chair with forward bending, this is the unconscious posture or unconscious behavior. This is not a false behavior. But someone telling you, Doctor Sahib, I am very calm. I never get angry. I never scold. Which symptom is more important? So whatever the patient may get manipulate you, because no one like to tell their weakness, right? So that's why we have to take such a reaction or emotional symptoms in a skillful manner. But the way he is sitting, their postures, their way of talking, whether it is a hasty speech, hasty talk, slow talk, the movement is slow, whether the patient is restless, these are some unconscious, subconscious process, or it is not voluntarily, it is involuntarily. That's why it is more important, right? That's why the importance of observation is more in the care homeopathy, right? That's why it is said that the way the patient say or telling to you is more important than the exactly what he or she is telling to you or narrating to you. The way how he or she is telling to you or narrating to you. right? Yeah, communicating to you, that is more important. So the always we can see the case taking. In case taking, always observe when the patient enters into your cabin. That's why it is said that the door, cabin door, your cabin door, and the chair or your table or where you are sitting, the distance must be significant enough to that the doctor should watch, the significant enough that the doctor should watch the patient when he or she is walking or entering the room, right? Or how she or he is sitting, right? So all the how patient enter the chamber, their talking style, their clothing style, the color of cloth, the sitting style, their facial expression while talking to you, way of talking, whether it is slow or hasty, record keeping. What is record keeping? Most of the time patients forget to bring the record, or you can see the records are very haphazard, here there one page, there one page, here they are not in a proper place. Or sometimes you get the patient, you see the patient where they arrange the each and every documents very meticulously, very properly, right? Proper arrangement, date wise. So this is we can call the fastidious nature, the perfect nature, the person doing the things very meticulously, so that you can derive the conclusion with this their cloth, their combing, their hair, way of hairs combing, that the patient must be a perfectionist, meticulous, systematic, like cleanliness, or is very fastidious, like that. This will help in the differentiation of remedy. If your remedy coming is the sulfur, if your remedy coming mersol or other remedy, right, and that your observation is different, then think twice before prescribing that remedy. If the arrangement, or if you observing this symptoms, the remedy must be like the arsenic or other forms of the arsenic, or the arsenic who having the perfectionist, systematic or meticulous behavior, right? So when the patient sitting at the edge of the chair, this shows the patient is more anxious. So we can come to the group of anxious, group of remedy, not directly, but at the end you have to write down this observation at the corner of page or the end of the page or the side, whatever you are comfortable, you have to write down that. If the patient sitting with the folded hand, that you can see or interpret that, this is a high self esteem person, here the respect is more important. When you see the respect, again, see in their life or life space, when you are investigated, might be the patient may be sensitive to the self esteem, and such a patient's elements from, or such a patient disease cause after the hurt of the self esteem, because it is the sensitivity of that patient. So when the sensitivity get hurts, the disease or the complaints derive. Like you see the staphysagria, when the humiliation, where the anger, indignation occurs, when mortification occurs, then the complaints start. Ignitia, you can see there when there is a loss, when there is a separation, these things come up in the life, then the complaints start, and this is evolve like that. So the case taking having the certain parameter, how we understand the person, how we understand the person, or how we understand the genetic simillimum. genetic constitutional remedy or simillimum. We can understand the genetic simillimum through these important parameters. If we just stuck up with the mental picture or mental symptoms, then your remedy is the partial simillimum. If we are observing just whatever the patient is behaving in front of you, this is the, you can say, though it is the important, but it is the partial understanding of the patient. So it is not just a mental makeup. In order to derive the genetic constitutional remedy, all the parameters are important. Like first, mental makeup, very important. Second is the physical makeup. Third, general makeup. And the fourth is the disease makeup. That is the defense mechanism called as the MISM. Now, what symptoms are more important in the mental makeup or the mind? Because most of our prescriptions, we are giving the lot of weightage to the mind, which is very, very important. Because all the diseases start from the disturbance in the psychology or disturbances in the mind. So the cause is there. So we have to evaluate it properly. So in the mental makeup, the most important that one parameter add by Dr. Praful Vijayakar sir to understand whether the patient is extroverted or introverted. Another important, as also the Dr. Kent has emphasized this parameter, that is the understanding the will of the patient. So according to the hierarchy, we must understand first the will of the patient, will, then intellect of the patient, then morals of the patient, then sensitivity, and at last there is a emotional reaction. Why this emotional reaction is not at the top or first or second or third? Why the will is important? Will is the desire to live, and reactions, emotional reaction is like anger, anxiety. If there is a despair, that is derived from the will. If there is a positivity, if there is a loathing of life, if there is a suicidal thought, that comes from the will. That's why it is the outermost or highest most to understand the patient. The weightage given to this is higher than the weightage to the emotional reaction. Right? We will see it in the brief, or we will see it in the details. The physical makeup कैसे जो दिखता है, जो that is called as the phenotypic expression of the person. There is a two-way genetic expression. One is the phenotype, second is the genotype. Or prescription might be based on sometimes the genotype prescription, sometimes the phenotype, or sometimes the combined. The phenotype prescription means where we consider the physical expression, where we given weightage to the physical expression, that the postures, the face में mental किस type का face है ना the hairs कैसे है, fingers, how it looks, the color, like that, the stature, the posture, the build up, all this. The general makeup, in general makeup consists of the speed of the person and even the speed of the disease. This is very important. The activity, side affection, thirst, appetite, sleep, craving, aversion also. And the disease makeup consists of the sora, psychosis, syphilis, that is the defense mechanism. We have to see the one by one so that we can understand it in a better manner. Because the no mental or physical activity or behavior is the random or the meaningless. Whatever the patient or whoever, healthy person, non-healthy person, diseased person, how they behave, and how they talk, how they sit, how they walk. Is it all these things are not a meaningless? Everything, how the patient expressing or the person expressing themselves is very, very meaningful, right? And that we have to be noted. All the mental or physical activities are the meaningful, are the purposeful, are and the connected with the previous life experience as defense to stimuli, and these are genetically determined. If the person sitting like this, if the person sitting with the one legs over the other knee, right? If the person sitting over the edge of the chair or looking down, or all these expressions, all this behavior are very meaningful and very important in order to consider the simillimum. It is not solely important. One try to understand. It is not solely important points to derive the remedy, but it is a part to understand the person. Barabar hai? Sometimes the patients show the auto behavior, or the behavior is the automatic. We can say the subconscious. बराबर है कि नहीं? They don't have the control, or sometimes they don't know they are behaving like this, right? These are the automatic behavior traits seen in every individual, whether notices it or not. Even sometimes the patient itself is not aware about that we are behaving like this. And this way of expressing is very, very important in the prescription, because they are arising from the genetic. These are called as the genetic expression. Why this is important? Because genetic expression and such genetic expressions are important to derive the genetic constitutional similitude. Like if for someone looking down, that means he or she is the shy. If the people, if person is sitting away from the group or alone, someone get easily startled from the slightest noise. Someone get restless. There are the fidgety legs or fingers. All these are the behaviors are the meaningful. So if you're looking the girls who are shy, you are shy, not poor eye contact, seems to be timid, and if you prescribe the remedy who is a very ardent, who is very dominating, aggressive remedy, है ना? Is opposite to that timid and shy nature, that means if you are prescribing that remedy on the basis of some few particular symptoms or few craving, aversion like that, without considering the mental expressions, the behavior, and without considering her behavior in front of you, without observing that behavior, then the remedy might be the wrong, right? Because this जो traits होते हैं, जो ऐसे behavior होते हैं, whether even the patient don't aware about it, these are developed over the years and years, and it's a part of the inherent, it's a part of the nature, and this is a very vital clue for a homeopath in determining the similitude, right? Because this automatic behavior can be seen as a physical movement, can be seen as a speech, can be seen through activity of the patient or the gait or posture of the person or patient, right? Now अभी physical movement में क्या देखेंगे? मैं बोल तो रहा हूँ कि physical movement देखो, speech देखो, but unless and until we don't know the expression of the physical movement, the varieties of the speech or variants of the speech, we can't able to pick up that things. It is always said that unless and until the things are in your mind, you can't see. बराबर है. You can't see. If you don't know the hastiness, the hurriedness, you can't see it in the, you can't write down the patient is very hasty, the talking is, the speech is very hasty, hurried, all the activities are very fast, hasty, right? If you don't know the how is the behavior, जैसे ये hysterical इसको बोलते हैं, hypochondriacal is this and this, you can't see, you can't identify in the patient. That's why first we have to see the understand the meaning of all these words so that we can able to see through our eyes and understand through the mind, right? So the speech could be the hasty, speech could be the slow, speech could be the fast, it could be the nervous speech, anxious speech, maybe the speech might be a sarcastic, egoistic, right? All these understanding these small things are very important, right? So the first in the case taking जो parameters थे उसमें introverted और extroverted देखें, है ना? Why this is so important? Why this is so important? Because according to Dr. Praful Vijayakar sir, this is the most innate characteristic. Innate means internal genetic genes में. These are the innate characteristic of the genetic presentation in any individual, whether he or she is the introverted or extroverted. Because if you see the genetics, some genes are very expressive. Those genes which are very dominant, and some genes are non-expressive, that is called as the recessive gene. तो जब जीन्स में ऐसा हो सकता है कि few are the very expressive, few are the non-expressive, that is few are the dominant, few are the recessive, that must be applicable in the human behavior in the form of introverted nature and extroverted nature. So individuals who are introverted do not express their feeling or share the feeling with others. And some are extroverted where they are like to mix with the people, they enjoy the people, they like to share their feeling comfortably with all the peoples, or most of the people. Right? So this introverted and extrovertedness, sometimes it is very obviously you can see by when you communicate with the patient, you can conclude that this is seems to be, or this is the introverted or this is the extroverted. And extroverted people who are very cheerful. Yesterday that one person is there, one boy was coming to with the follow, communicate lot of things with their जो क्लास में हुआ, इनसे बात किया, उससे बात किया, मेरा बिहेवियर ऐसे, मैंने ऐसा बताया, वैसे बताया, irrespective of whether I am asking or not कि क्या हुआ क्लास में, किससे बात की और कैसे, in a very joyful and cheerful manner. So these things are must be noted in order to understand the genetic similarium. अब ये introverted क्या रहता है और how we come to the conclusion why the person becomes introverted. There must be a, there might be a something which change the state of mind, some cause, like in the nitramure, maybe in the initial days of the life, though it is genetically introverted, are quite expressive, but when there was a disappointment, there was a loss, there was an emotional hurt, the patient goes into the shell and become introverted more and more because of the fear of being hurt, right? So like that, we have to understand the timidity. Abhi timid peoples like Barata, Calcaria, Pulsatilla, Cilicia. The introvertedness could be because of the haughtiness. If someone says themselves the superior from the others and they consider other people, the colleagues are the inferior, they try to avoid their connectivity. They try to avoid that people, never try to connect with that people. Sometimes when the people are very hideous, hiding nature or secretive, they also behave like a introvertedness, like a Ignatia, Nitromure, Barata, Sepia, all the carbons, most of the carbon. Sometimes when the patient is in the indifferent state, also behave like introverted, or the peoples who having the dull intellect, intellectual capacities poor, is also behave in an introverted manner. That's why just don't take this introverted in plain manner. Try to understand the process or try to understand the why this goes or why this person is introverted or in what way this person is introvert. Why? Because of haughtiness, because of timidity, because of the uh, low intellectual quality, like a Barata car, who are living or sitting alone, right? Never participate in the activity because of their intellectual capacity, because of their dullness of intellect, right? Because of the fear of laughing, the sensitivity that the person becomes laugh, or there might be some mistakes might happen with us, right? So the thinking process that we needs to evaluate, the thinking process behind it, behind the behavior. When we see the extrovertedness कैसे express होता है? In the form of loquacity, the peoples are more talkative, more loquacious, like Hyoscyamus, Lachesis, Moschus, Sulfur. Might be the extrovertedness is expressed through vivacious nature. That peoples are very joyful, cheerful, very live peoples. And you can see in the picture also the vivaciousness or liveliness, how they are connected with each other. Right? So like a Stramonium, cannabis indica. The talk wandering, jesting, childish, boaster, the talkative peoples or talkative peoples boasting their own achievements or talking their self only. Never consider other. They try to talk their achievement in front of the peoples. These are the boaster. These are boasting their self, right? So extroverted, introverted. Another the right. Then the important is the will in the homeopathic case taking or understanding the person. More than this is the most important in the whole symptoms. इवन द इंट्रोवर्टेड एक्सट्रोवर्टेड तो एक एक्सप्रेशन है, पर विल, इंटेलेक्ट, मोरल्स, सेंसिटिविटी एंड इमोशनल रिएक्शन, इसको हम अगर देखें तो विल कम्स एट द टॉप मोस्ट. What is the will? We called it as इच्छा शक्ति, the determination, power to decide. It is the faculty by which a person decide and initiate the action, right? It is the faculty by which the person decide and initiate the action. That's why we can categorize this as whether the person is having the positive will or negative will. Will is there, but the determination negative के तरफ जा रहा है, positive के तरफ जा रहा है. Whether there is a lack of confidence, timidity, or whether there is a courageousness, right, or audacity, like this. And again, this presentation of the will again depends on their fundamental miasm in that state of the individual. Right? The consideration of will is very important criteria in the selection of genetic simillimum, as it is one of the most fundamental innate characteristic of the individual. It is the most fundamental innate characteristic of the individual. That's why while deciding the genetic constitutional simillimum, will has the most important factor and understanding the will in the person, in the patient. How we how we elicit that? The next question might be, sir आप will तो बोल रहे हैं कि how we elicit in the patient. हम कैसे समझेंगे कि इसका will कैसा है, पॉजिटिव है, स्ट्रांग है, पुअर है. So in order to elicit in the case from any individual, you must ask them or understand their reaction in the crisis. Understand the reaction in the crisis. That someone say कि when if the female is there and she narrating that कि long back or few months back the her husband got the sudden chest pain and heart attack. Someone say I got collapse. Someone says I immediately call doctor. I immediately call all the other peoples and immediately keep that person husband or immediately go to the hospital. मतलब they shows the courageousness, है ना? They shows the firmness. They doesn't puzzled, confused. Or someone say I'm getting so confused, I don't understand what to do in that situation. So in that crisis, how she decide and how she take an action, right? So steps कैसे लेती है, how, and also understanding the steps taken to them to avoid the crisis. So will कैसे बोलेंगे हम, पॉजिटिव विल और नेगेटिव विल, द करेजियस, द ऑडेसिटी, द पॉजिटिविटी. हम देखते हैं ना कि केस में पेशेंट को ग्रॉस पैथोलॉजिकल डिसीज है या ऐसे बीमारी है जहाँ पे उनको पेशेंट को बताया गया है नहीं ऑपरेशन ही करना पड़ेगा, नहीं इसका कुछ इलाज नहीं है, बट पेशेंट इज स्ट्रगलिंग एंड पेशेंट हैव स्ट्रॉन्ग बिलीव दैट माय डिसीज gets cure if I take the proper treatment and proper care. So when you see the positivity in a condition where most of the people gets despair, अभी despair, निराश, hopeless, despondent, this positivity becomes syphilitic. आप बोलेंगे पॉजिटिविटी पॉजिटिव तो सब पॉजिटिविटी होना मतलब सॉरी कहेंगे, बट इन दैट सिचुएशन, इन दैट क्राइसिस, if the person is more positive about the outlook become more positive about his or her disease in the future, their future, then this positivity has the higher mark because it comes from the will, the pertinacity, the perseverance, the determination, hopeful रहना, optimistic रहना, all this shows the positive will. So the most of the metals, most of the theorem have a strong will. They are the strong will person. They are strong will remedies, right? In contrast, if you see the negative will, that is the timid person, bashful person, very fearful, anxious. These people have the lot of lack of confidence. They are having the embarrassment. They get easily despair, hopeless, loathing of life. They goes into the suicidal thoughts. This shows there is a lack of will, or this shows the negative will. Both are important. Both are at the top. Positive raho ya negative raho. So the symptoms deriving from the will is very important, right? So negative will matlab sulfur, Kali group and the most of the carbon group. Calcareous group is having the negative will, right? So will first most important. Second is the intellect. Intellect. It is the faculty by which the person is understanding the thing. It is the faculty of reasoning and understanding objectively. It is the person thinking capacity. हम बोलते हैं ना सोचना. That is the intellectual capacity of the person. How he think, which is the another innate characteristic of the presentation of the genes. Another innate characteristic of each individual, which is the presentation of the genes. This tells us about the understanding of the individual as also his ability to comprehend and react in a particular situation. मतलब एक particular situation आई है, how he thinks and how he react to that situation by their thinking process, by their comprehension. So good intellect मतलब कैसे कि हम बोलते हैं ना intellectually very strong है बंदा, girls, boy, person, male, female, having the active memory. The comprehension is again comprehension भी काफी अच्छा है. Sharpness of mind, alertness, sharpness of mind, mathematics, aptitude for all this shows the good intellect, high intellect, right? So memory active. Most of the time you can see the rubrics like memory active, uh, events for the past, or memory active, recollection involuntarily, unknowingly. दे मतलब वो वॉलंटरीली, जैसे नेट्रमी और कैसे ब्रूड करता है वॉलंटरीली, उसको ब्रूड करता है, थिंकिंग करता है. Involuntary recollection of the past. This is the syphilitic. And if you get such a symptoms, this is very important in prescribing the remedy. Right? So memory active, or the rubric memory active events for past or recollection involuntary, the most important remedy here mentioned in the repertory is the hyoscyamus. Remedy mentioned in the repertory is the hyoscyamus. In contrast, if you see the memory weakness of memory, how it reflects the forgetfulness, mistakes making while doing the work, or mistakes making while talking, childish behavior, the concentration difficult. This shows the weakness of memory, or this shows the person having the poor intellect. Right? Poor intellect, weakness of memory, forgetfulness, poor intellect. This is very important. For example, if you see the lachesis, the ophidia, in most of the ophidia, hyoscyamus and Kaufia, the memory is active and can remember, understand, and comprehend easily the long past. The memory is active and can remember, can understand, and comprehend easily. In the same way, if you see in Baraita carb, in the Bufferana and other such remedies like carbon, the memory is dull and compromised. In Baraita, especially, the memory is so severely compromised due to something that therefore the individual is dull in comprehending and reacting to the situation. They don't understand how to react, what to act, how to act in certain situation, or in situations where the reaction is important. Right? So the memory is dull, memory is active is the important symptoms. Right? So the intellect in the Baraita is compromised. There is a dull intellect. That is why we can call the dwarfish person. And as a result, this everything is misplaced. So this is the very key rubric बोलो या keywords for the Baraita carb, that is the misplace. So if you get the symptoms, misplace मतलब जो जहां होना चाहिए वहां नहीं है. Think of the Baraita car. That means even the Dr. Prafur Vijayakar sir has explained about this misplace कि even if मतलब person आता है, because of their dull intellect they don't understand what the things are going with him or her, or patient having the cancer or ऐसा बीमारी ऐसे disease है which is very very harmful, dangerous, and the person is more giving more importance to their acne or color of the skin or other least important thing. This is also misplaced. मतलब जहां होना चाहिए जो करना चाहिए वो नहीं है, भलता ही है. लिटिल थिंग्स को इंपॉर्टेंट दे रहा है. डॉक्टर साहब देखिए पिंपल्स आ गया, and he or she suffered with a dangerous disease where you see there is no concern about it. It is not out of the carelessness or heedless. It is out of they don't think about it. The intellect is dull. That's why there is a anxiety is misplaced. So if you see such a patient where even the anxiety is misplaced, the concern is misplaced, then think of the Baraita group or Baraita remedy. Right? This is very important. This yeah, even this will not explain in the Matra Medica. Right? So this is very important practical tips. The weak intellect and the misplaced manifestation is the key point of the Baraita. Right? Even you don't get the rubric like this. This is the understanding through if you understand this will, intellect, and all these parameters. The third important point, if you take away the introverted extrovertedness, the morals of the person or the morals of the patient. Morals हम क्या बोलते हैं ना, morals मतलब अच्छा बुरा, good and bad. When the person is concerned with what is the good and what is the bad aspect of the human character, they are concerned with accepted rules and standard of human behavior. ये सोसाइटी के अनुकूल है, ये सोसाइटी के अनुकूल नहीं है, ये ह्यूमन बिहेवियर के अनुकूल है, ये अनुकूल नहीं है. जो ये अच्छा बुरा जो सोच रहा है, उसमें सोचने की जिसमें ताकत है या सोचता है, थिंकिंग उस तरह से है, दिस इज गुड एंड दिस इज द बैड, दिस इज नॉट गुड. इफ यू आर वर्किंग लाइक दिस इज वेरी बैड. इफ आई आर डूइंग दिस इज नॉट अ गुड. जहां पे कंसाइंस आता है, because these are the value which are inculcated in an individual. Barabar? They are already imbibed in the individual in their formative years, but not all the individual who are taught these morals imbibe them. मतलब जो आप पढ़ाएंगे बचपन में तो एवरी इंडिविजुअल नॉट कि सब कंसेंशियस बनेगा या मोरली स्ट्रांग रहेगा. इट अगेन डिपेंड्स ऑन द इनहेरेंट ब्लूप्रिंट, क्या इनहेरेंट कैरेक्टरिस्टिक फीचर्स, क्या हेरिडिटरी या जेनेटिकली क्या लेके आया है. दैट इज अगेन इंपॉर्टेंट. दैट्स व्हाई these morals are important point. Thus there has to be certain protein that are responsible in every individual which are instrumental in inculcating these values. Right? Some proteins are the responsible like the neurotransmitters जो होते हैं या genes है ना, neurotransmitters also, because whole the body is made up of the proteins, even muscles, nerves, and bones, all these are the building block in your body, proteins. Right? So if they are doing their work harmoniously, properly, but if there is a damage to protein, if there is misplacement of protein, If there is a change in the protein structure, then there will be a disease, or there will, we can call it as a mutation, because of change in place of the amino acid. Amino acid is nothing but the proteins, right? So the good moral, bad moral कैसे हम देखेंगे? सिम्टम्स है ना, जस्ट मोरल बोलने से नहीं होगा, हमको उसके सिम्टम्स समझ में आना चाहिए, पता होना चाहिए, विद द मीनिंग, विद प्रॉपर एक्सप्लेनेशन और अंडरस्टैंडिंग कि गुड मोरल्स मतलब क्या. द पीपल्स हु आर ओबीडियंट, they follow the things. The person who are follow, try to understand and obey the command. It is not obedient like कि कुछ भी बोलो सुन लेगा. Then it is like a baraita, कि वो सोच नहीं रहा है अपने दिमाग से, किसी ने कुछ बोला गधा बन जा तो गधा बन रहा है, घोड़ा बन जा तो घोड़ा बन रहा है. इट इज नॉट लाइक दैट. गुड मोरल्स मीन्स उसको समझ रहा है कि ये दिस इज द गुड थिंग्स दैट वी हैव टू फॉलो इट, राइट. देन रिलीजियसली, religious affection is again the good morals. Anxiety conscience of what is the right, what is the wrong, and whatever. If anxiety conscience, if the person doing the wrong things, then goes into the guilt. अभी ये guilt में कौन जाएगा? Whose morals having the high, who are morally high, who are morally intact, who are having the good morals, they goes into the guilt easily. अभी जिसके morals ही नहीं है, बैड और गुड और बैड उसमें समझने की ताकत ही नहीं है, वो समझ ही नहीं रहा है. इट इज नॉट बिकॉज ऑफ द डल इंटेलेक्ट, बट बिकॉज दे डोंट वांट टू सी दैट, है ना. जैसे फ्लोरिक एसिड है, कल्केरिया फ्लोर है, वेराट्रम है, या अदर रेमेडीज, मर्कसॉल है. दे डेंट वांट टू बी ओबे, दैट इज द बैड मोरल्स. डोंट वांट टू बी ओबे, दैट इज कॉल्ड disobedience. They are very lascivious, lavid, involuntary, showing shamelessly their nudeness. Person who having the criminal tendency without remorse is having the very very bad morals and comes under the syphilitic miasm. If there is a criminal tendency, or a person doing some wrong things with there is a remorse feeling that I am doing the wrong things, this is why I can say it is a psychotic in nature. But when the person having the criminal tendency, doing the things, harming the other peoples without regret or remorse, then it goes into the syphilis. See how the miasm change with the reaction. Cruelty, cruel, unfeeling, hard-heartedness, perversion. This is very, very high syphilitic rubric or symptoms. This is syphilitic symptoms or syphilitic rubric. Hard-heartedness. कि कोई फीलिंग नहीं है, कोई इमोशंस नहीं है, ब्लंटेड है, नो रिग्रेट, नो रिमोर्स एट ऑल, राइट. So these are the symptoms which, if present in the patient, or we have to search in the patient and gives importance to such a symptoms, so that you get the proper genetic simillimum. है ना. लास्ट इसके बाद है conscience, the fourth. Will, intellect, moral, and the conscience. Conscience again the satsat vivek buddhi. It is again the quality of doing the things properly, in a right way, in a wrong way, है ना. morals और conscience का काफी interact ये पास में है. This is the quality of an individual to which he owes his existence and progress in life. That means conscience, the person must be a conscience in order to become progressive in the life. The part of your mind that tells us that you, if what you are doing is right or wrong. To remain a healthy individual, the basic unit of life, that is the gene, have to be function regularly, religiously, and diligently. Matlab, if the person wants to be healthy or remain healthy, the genes, their proteins, all must be function in a proper way, harmoniously, religiously, and diligently. What is the diligently means? Doing the things, doing the proper efforts seriously, sincerely, ईमानदारी से काम करना, efforts लेना, ईमानदारी से, doing or taking the efforts seriously, right? These are diligent, right? If this happen, then the individual serve the purpose of existence, that is the progress. If the person or their genes and their proteins are doing their work in such a manner, then there must be a human progress होगा या person का progress होगा, बराबर. तो if there is a, ये दो क्वालिटी अगर रहेंगे, diligence and the conscience, this makes an individual progress in their life, right? The another important point which must be considered in the case taking is the sensitivity. Because sensitivity in each and every individual is different. How we understand this? When the stone falls on the glass, if someone throw the stone on the glass, definitely the glass break, right? Definitely glass break. But that same stone, if it falls on the wooden material or wood or the metal things, it will not break out. मतलब चीज एक ही है, बट ऑब्जेक्ट चेंज हो रहा है. ग्लास पे मारेंगे स्टोन तो फूट जाएगा ग्लास. दैट मीन्स ग्लास इज व्हाट इट मीन्स, दैट मीन्स द ग्लास इज सेंसिटिव टू दैट स्टोन, but metals and wood are not. In a same manner, some person are sensitive to noise, some person are sensitive to reprimand, scolding, some person are sensitive to humiliation, criticism. All these sensitivity are differ from person to person. This is very important. Every individual on this earth is sensitive or not sensitive to something or other thing, which is peculiar to him and him only. Means someone is sensitive to self-respect, तो वो रहेगा ही throughout his life. Someone is sensitive to the scolding, वो throughout life sensitive रहेगा. Sensitivity never change. Try to understand this. If the person is sensitive to scolding, तो बचपन में अगर उसको scold किया है किसी ने, तो might be he express or she express with the weeping, वो रोना शुरू कर देंगे, immediately रोना शुरू कर देंगे. अभी जब वो adult life या बड़ी होती है, तो when someone scold her, she try to argue with other person. Might she gets very very angry, she become abusive, she quarrel with that person, even fight and bite with that person, right? Here the expression is change. वही बच्ची जब छोटी थी, was child, she expressed through the weeping, now she expressed through something else. Here the sensitive, the person is, that girl is sensitive to the scolding or reprimands. Sensitivity remain the same, but the expression of the sensitivity change from time to time, and it depends on the underlying mechanism. Try to understand. ये तो हमको देखना है कि चाइल्डहुड में कैसी, बराबर है कि नहीं. यही तो इवोल्यूशन ऑफ माइजम होता है कि एक पर्सन जो 16 में कैसा है, फॉर एग्जांपल सेपिया, कॉम्पिटिटिव है, एक्साइटेबल है, टॉकेटिव है। वो सिफिलिटिक में जब जाती है तो इंडिफरेंस हो जाती है, शेल में चले जाती है। या साइकोटिक में जब रह जाती है तो कंजेशन, स्लोनेस, रिलैक्सेशन, ये सब आता है। तो हाउ द माइजम इवॉल्व इन द रेमेडी हमको स्टडी करना है, और पर्सन में भी हमको स्टडी करना है कि कैसे माइजम इवॉल्व हो, राइट। So the different remedies are genetically sensitive to certain things and not sensitive to others. Might be someone very sensitive to humiliation, is not sensitive to the noise. जरूरी नहीं है कि सेंसिटिव है मतलब हर चीज को सेंसिटिव रहेगा, दैट पर्टिकुलर थिंग्स के लिए सेंसिटिव, एंड दिस यू कैन सी थ्रू आउट हिज लाइफ, they never change. Try to understand this because these are the genetic expression, these are the genetic expression. Some, for example, some are sensitive to money matter, some are sensitive to respect and the ego or being hurt. So each and every remedy has their own sensitivity and each individual has their own sensitivity. For example, carcinosin will be a sensitive to reprimands, whereas the naxomica will be sensitive to noise, like this. Staphysagrina is sensitive to, because high self-respect, so sensitive to humiliation, sensitive to indignation, mortification, all this. So the most important point you should note down, the sensitivity belongs to the constitution. Sensitivity belongs to the person constitution, but the reaction of this sensitivity, the reaction or expression, the reaction of this sensitivity will depends on the fundamental mechanism. Means जो बच्ची बचपन में कोल्ड के कारण रो रही थी, दैट मीन्स सोरिक रोना था उसका, अभी वो साइकोटिक और सिफिलिटिक में चली गई, अगर उसको कोई स्कोल्ड करता है तो थप्पड़ भी मार देंगे, बराबर। सो द सेंसिटिविटी बिलोंग्स टू द कॉन्स्टिट्यूशन विच इज नेवर चेंज, बट द रिएक्शन ऑफ द सेंसिटिविटी विल चेंज, दैट डिपेंड्स ऑन the underlying miasm or the fundamental miasm, that state of mind or the miasm at that point, right? Hope you understood this, because this is very important in order to understand the person. And this is not only a physical disease se related, yeah, we are dealing with whatever the disease, whether it is physical disease like a pancreatitis, appendicitis, tonsillitis, allergy, or whether it is a mental disease. Because again the mental disease has the two parameters, the neurotic disease, neurotic disease, neurosis बोलते हैं, और psychotic है कि नहीं, वो मैं बताऊंगा नेक्स्ट सेशन में। और स्कोप कौन से डिसीज में है ना, सो दैट यू कैन हैंडल इट वेरी कॉन्फिडेंटली। अनदर इंपॉर्टेंट पॉइंट इज द सेंसिटिविटी हो गया, इमोशनल रिएक्शन ये लास्ट में दिया है, ध्यान में रखिए, इन द मेंटल मेकअप ये लास्ट में दिया इमोशनल रिएक्शन। और मोस्ट ऑफ द फिजिशियन बोलो, होम्योपैथ, ये इमोशनल रिएक्शन को ही हम ज्यादा वेटेज देते हैं, हम भी, इवन मी लॉन्ग बैक, एंगर कैसा है, गुस्सा कैसा है, डर है क्या नहीं, हम इसी पे ज्यादा इंपॉर्टेंट देते हैं, कोई भी हो, सिफिलिटिक केस हो, साइकोटिक केस हो, कुछ भी। वी नेवर सी, वी नेवर अंडरस्टैंड व्हाट इज द विल ऑफ दिस पेशेंट, मोरल कैसा है, इंटेलेक्ट कैसा है, ये नहीं हम देखते, या अगर दिखा भी हम उसको नजरअंदाज कर देंगे, because we don't know the importance of that thing, right? So now you have the chance to understand this, why the emotional reaction, like the all the emotions like anger, sadness, the grief, fear, that we experience is a result of certain specific chemical transmitters, neurotransmitters, that are synthesized and released in the body. The synthesis results from the specific genetic coding in every individual. दैट डजंट मतलब ये नहीं है कि वो जेनेटिक एक्सप्रेशन नहीं है, बराबर है, but it change this according to the neurotransmitters or dopamine that decide the mood, बराबर है, but the willing to live or the despair state where the patient become hopeless and having suicidal thought like a will, will इसको बोलेंगे, और patient is angry abusive, है ना. So this will has the highest importance in understanding the totality or while dealing with when we evolve or make a totality. These symptoms are have the highest importance and this has the low importance. But whatever the predominant feature is there in the case, that is again the important thing. So the Naxomiga reaction will be more of anger, whereas that of ignition or acid force will be grief or sadness. Right? If the triggering factor come or the sensitivity come, sensitivity, there is a trigger. If someone trigger the sensitive point, the Naxomica reflect or react in an anger way. But in the contrast, the ignitia or phosphoric acid becomes sad when someone hurt the sensitivity. Right? When someone hurt the sensitivity. So it's a 4:30. I want to finish this case taking, whole case taking, but I don't think the it should. We can finish. I can finish this in 5 to 10 minutes. It requires again the. It requires again half an hour or 1 hours. 50, it is 64. Because I want to explain in detail each and everything so that you can understand its importance. जस्ट मैं अगर बोल दूं कि अब ये सिम्टम है, इसको इंपॉर्टेंट दो, दैट इज नॉट सफाइस. यू हैव टू अंडरस्टैंड व्हाई this thing is more important and this thing is less important, or why, what is the importance of these symptoms in or hierarchy in the symptoms. हायरार्की मोस्ट बहुत इंपॉर्टेंट है ना. अभी फॉर एग्जांपल किसी को मोशन सिकनेस होता है या sight of the food, sight of the food causes the nausea feeling, sight of the food. अभी किसी पेशेंट को थॉट ऑफ द फूड causes the nausea feeling and someone have the smell of the food causes the nausea. See the difference in the symptom. One has the one person or one patient have the nausea, complaining of nausea by thinking of the food itself. One is by sight of food, मतलब देखने के बाद nausea होता है, खाने की तरफ देखने के बाद looking towards the food causes the nausea, and someone smell of the food causes the nausea. If you, if I ask to give weightage to these symptoms or hierarchy to this symptom, which symptom have the more important or more syphilitic? अगर इसमें से तीन में से एक मोस्ट इंपॉर्टेंट सिम्टम को चुनना है, सो विच इज दैट symptoms? Is it the sight of food causes nausea is more important, or the smell, or the thinking of the food itself causes the nausea is more important? So the most of or everyone is come to the conclusion कि thought is more important. यहाँ पे ऑब्जेक्ट नहीं है ना, दो देर इज नो ऑब्जेक्ट, वो देख नहीं रहा खाने को, जस्ट सोच रहा है, तो भी उसको नौशिया फील हो रहा है. सी द सेंसिटिविटी, द हाइट ऑफ सेंसिटिविटी कितना है, दैट्स व्हाई इट इज हाईली हाईली इंपॉर्टेंट दिस सिम्टम. कोई बोलता है ना बस में आधे घंटा 1 घंटा जब जाऊंगा, जब सर्कल में बस घूमेंगी तब मुझे नौशिया वोमिटिंग होती है. एंड समवन से by looking at the bus I have the giddiness and nausea and vomiting. How much important this symptom is? Motion sickness. This is highly syphilitic. This is highly syphilitic. So in every symptoms, if you filter the symptom through the myasm, if you filter the symptoms, each and every symptoms through the myasm, you will get the proper totality. Understanding is different. Person understanding कि वो timid है, डरा हुआ, angry है, ये है, that is different. But when comes the totality, especially miasmatic totality, then the filtration, such a type of filtration or understanding is very, very important. Right? I don't have the hurry to finish this session series. Right? I have to want to take so that you peoples or doctors who are all, I think everyone in this group are the practitioners, right? So it should be helpful in the practice, right? And definitely if you apply it in a proper way, it will boost this understanding, will boost your way of thinking and your practice, right? So till now, any question? केस टेकिंग में मेंटल मेकअप हो गया, सिर्फ अभी फिजिकल मेकअप बाकी है. एक्टिविटी, माइजम तो हम डिटेल में नहीं लेंगे, है ना. फिजिकल मेकअप कैसे रहता है, फिजिकल एक्टिविटी कैसे रहती है, दैट वी हैव टू सी. फेस के टाइप्स क्या है ना. और उससे रिलेटेड रेमेडी और उससे रिलेटेड रूब्रिक, मतलब साइमल्टेनियसली हमको. और ये सब जो है, ये ऑब्जर्वेशनल पार्ट इसमें ज्यादा है फिजिकल मेकअप में. तो उसमें रेमेडीज कौन सी है और उसमें रूब्रिक्स हम कैसे डिराइव कर सकते हैं, एंड विच रूब्रिक इज मोर इम्पोर्टेंट, दैट वन बाय वन हम उसको भी समझेंगे. मतलब साइमल्टेनियसली केस टेकिंग, मल्टीमेडी का और रूब्रिक अंडरस्टैंडिंग, ये तीनों थोड़ा मतलब हमारा हम डिस्कस करेंगे, राइट. So before proceeding to the mental cases or mental status examination, we have to finish this. I think in the next lecture we finish and then come to the mental state, goes to discuss the mental status examination, and then we will take the one by one case. है ना. केस में थोड़ा ज्यादा ये हो सकता है कि आप ऐसा लगे कि थोड़ा बोरिंग हो रहा है, बट इट इज वेरी वेरी इंपॉर्टेंट एंड पे अटेंशन सो दैट वी विल अप्लाई इट. हम अगर डायरेक्टली प्रिंसिपल एंड प्रैक्टिस को समझे बगैर सिर्फ केस थ्रू ये करेंगे तो आपको समझने में बहुत मुश्किल आएगी. बराबर. केस थ्रू ये जनरल अंडरस्टैंडिंग है ना. केस में स्पेसिफिक अंडरस्टैंडिंग होती है, वही रूब्रिक होता है, लिमिटेशन आता है. बराबर है. पर एक केस हमको बहुत कुछ सिखा के जा सकती है. इट डिपेंड्स ऑन अस. तो वन बाय वन हम केस लेंगे, है ना. एंड हाउ टू सॉल्व इट, दैट वी विल सी. ओके. सो होप all the doctors, the homeopath enjoy this online session. If you have any suggestion, always welcome. So I stop this session here. We will meet. We will meet on the next Friday at the same time, 3 o'clock. Try to revise the whatever the things that I have explained today. Excuse me, sir. Is there any question?
Yeah, sir, can you share the slide on intellect?
It's very difficult. It is very. I'm. I will share the video recording instead
Okay,
of
sir.
slide, है ना? थोड़ा सा ये
Thank you, sir.
पर्सनल ये हो जाता है ना?
ठीक है
ये
सर.
क्योंकि ये कोई किसी का कॉपी नहीं किया है, इसको बनाया गया है, तो इट्स वेरी डिफिकल्ट टू शेयर, है ना? तो मैं रिकॉर्डिंग शेयर करूंगा सो दैट यू कैन take that advantage. And if you have the question, you can put up in the next session or you can message me, right? Thank you very much. So if the motion sickness only in the heel area, not normal road, even if it is the motion sickness, heel area में भी है ना? So we can consider it. बराबर है? We can consider it. बट द इंटेंसिटी मतलब वो उतना सिफिलिटिक नहीं होगा जितना मैं बताया कि वो सिम्टम्स कैसे वैरी होते हैं कि गाड़ी को देख के भी या गाड़ी के पास गाड़ी में चढ़े नहीं फिर भी नौशिया होना शुरू हो गया, यहाँ तो हिल पे, तो ये उतना पावरफुल नहीं रहेगा. if some other symptoms is more powerful, give the weightage to that symptoms more than this, right?